Welcome to our exploration of a compelling and cautionary topic: why some luxury resorts have a higher death rate than others. While luxury escapes are often associated with relaxation and opulence, there are myriad factors that can influence guest safety and well-being. From location and environmental risks to the adequacy of medical facilities, we'll delve into the complex interplay of elements that contribute to the varying safety records among luxury resorts. Join us as we unpack the critical issues from health regulations to psychological stress, revealing why some destinations may pose more risks than others. 1. Location and environmental factors. Luxury resorts are often nestled in exotic locales, which, while breathtakingly beautiful, can also pose unique environmental challenges. Many such resorts are situated in tropical regions, making them susceptible to hurricanes, tsunamis, or even earthquakes. For instance, the Atlantic hurricane season has become more intense and frequent, as reported by the National Oceanic and Atmospheric Administration, NOAA, largely due to climate change. This increased weather volatility can result in higher mortality rates during natural disasters. Beyond weather-related issues, some resorts are located near dangerous wildlife or unstable geological zones, which can further elevate the risk of accidents. The allure of these destinations often overshadows these potential hazards, but they are indeed factors that can influence the safety of guests. 2. Health and safety regulation. The stringency and enforcement of health and safety regulations can vary significantly between luxury resorts, depending on the country they are located in. In some regions, regulations might be lax or poorly enforced, which can lead to unsafe conditions for guests. A report by the World Health Organization, WHO, highlighted that inadequate safety measures in hospitality settings can lead to a rise in accidents and fatalities. For instance, resorts that fail to adhere to strict food safety standards might experience outbreaks of foodborne illnesses, posing a deadly risk to vulnerable guests. This disparity in regulatory enforcement can be a crucial factor in the differing death rates observed among luxury resorts. 3. Medical facilities and emergency response. The proximity and quality of medical facilities available to luxury resorts are paramount when it comes to guest safety. Resorts located far from hospitals or those lacking on-site medical staff might struggle to provide quick and efficient care in emergency situations. The American Journal of Public Health has emphasized that timely medical intervention can greatly reduce mortality rates in critical conditions. Resorts in isolated or remote areas may not have the necessary infrastructure to handle severe health issues, which could lead to higher death rates. Guests often assume that luxury means safety, but the reality can sometimes be starkly different. 4. Alcohol consumption and substance abuse. Many luxury resorts promote a vibrant party atmosphere, which can unfortunately lead to excessive alcohol consumption and substance abuse. According to the National Institute on Alcohol Abuse and Alcoholism, alcohol-related incidents are a significant cause of death among vacationers. Intoxication can impair judgment, leading to accidents such as drownings, falls, or even vehicle crashes. Resorts that do not actively monitor alcohol consumption or fail to provide adequate support for guests under the influence may experience higher mortality rates. The focus on leisure can sometimes overshadow the need for safety, leading to tragic outcomes. 5. Adventure activities and safety measures. Luxury resorts often offer a range of thrilling adventure activities, from scuba diving to ziplining. While these activities can enhance the vacation experience, they also come with inherent risks. The International Journal of Travel Medicine reported that adventure tourism could lead to higher injury and death rates if proper safety measures are not implemented. Resorts that do not enforce strict safety protocols or fail to provide adequate training and equipment for these activities may expose guests to unnecessary dangers. The thrill of adventure often comes with a price, and without stringent safety measures, these activities can turn perilous. 6. Guest demographics and health conditions. The demographic profile of guests can significantly influence the death rates at luxury resorts. Older adults or individuals with pre-existing health conditions are more susceptible to health emergencies during their stay. A study published in the Journal of Travel Research found that older travelers face a higher risk of medical emergencies while on vacation. Resorts that cater predominantly to older guests may need to implement additional safety measures to accommodate this demographic. Understanding the unique needs of different guest profiles is crucial in ensuring their safety and well-being. 7. Cultural and language barriers. Cultural differences and language barriers can complicate communication between guests and resort staff, leading to misunderstandings and potentially dangerous situations. A survey by the International Association of Hospitality Professionals highlighted that miscommunication is a significant factor in guest accidents. Resorts that do not employ multilingual staff or fail to provide cultural sensitivity training might inadvertently increase the risk of accidents and fatalities. Effective communication is key to ensuring guest safety and minimizing risks in unfamiliar environments. 8. Food safety and hygiene practices. Food safety is a critical concern, especially in luxury resorts that pride themselves on offering international cuisine. The Centers for Disease Control and Prevention, CDC, reports that foodborne illnesses can lead to severe health complications, particularly for travelers. Resorts that do not adhere to strict hygiene practices or source food from unreliable suppliers may experience outbreaks that can result in fatalities. Ensuring proper food handling and preparation is essential for maintaining guest safety and preventing potential health crises. 9. Psychological factors and stress. Vacations are often seen as a time for relaxation, but the stress associated with travel can have adverse effects on health. The American Psychological Association notes that travel-related stress can exacerbate existing health conditions, leading to an increased mortality risk. Luxury resorts that do not provide adequate support for guests dealing with stress or anxiety may see higher rates of health crises during their stay. Recognizing and addressing the psychological needs of guests is crucial in ensuring a safe and enjoyable vacation experience. 10. Crisis management and communication. Effective crisis management and communication are paramount in ensuring guest safety during emergencies. Resorts that lack a clear crisis response plan may struggle to protect guests during natural disasters or health emergencies. A study by the International Journal of Hospitality Management found that resorts with well-defined emergency protocols had lower mortality rates during crises. Ensuring that staff are trained in emergency response and communication can significantly impact guest safety. In times of crisis, clear communication and swift action can make all the difference in safeguarding lives.